Sir, so I feel that, for small cancers of the tongue, it's better to kind of leave it open or raw, and, sometimes, primarily suture it. So, how do you usually perform this, sir? What do you do?
You see, small lesions, superficial lesions of the tongue, we can just excise it and leave
Hmm.
it open safely. But most of them are not that exophytic. They are some bit endophytic, some bit exophytic. So we need to do a WLE, wide local excision, and tongue lesions really need to be managed with a
Hmm.
good wide local excision and a frozen section
Hmm.
examination. Thereafter, the raw surface, I have been leaving it open for more than 10 years, in fact, till about 2020. I've been leaving it all open. There's this marginally increased risk of hemorrhage, secondary hemorrhage or reactionary hemorrhage.
Hmm.
So, for the last 4 5 years, I closed them primarily, always vertically. Never twist the tongue. The tongue tip should always be
Not be
left,
rotated,
should
yes.
not never be
Yes.
reported
Yes.
rotated. So, but then I think the best is if it's a slightly largest defect, partly it's called a modified primary closure.
Hmm.
Partly close it, partly leave it open, so that finally the result should be that the tongue should not be tethered to the floor of the mouth.
Yes.
The tongue
Mobility.
mobility is of the prime importance.
Yes.
So that's why I put a flap also, a free flap, only if the tongue mobility is going to get
Or
restricted.
the defect is a little
Whatever be the
larger.
large the defect, I do not want to reconstruct the tongue for cosmesis.
Hmm.
Tongue is not a organ to be,
Exactly. Hmm.
for cosmesis. And I do not bring in tissues from outside to for volume replacement. Tongue doesn't require volume. Tongue, basic anterior tongue, requires mobility,
Mobility.
sideways, up and down, out and in. If this can be preserved by our modified closure, that's the best. And if the floor mouth it's getting tethered to, then I do definitely. If the floor mouth is involved, definitely bring in a microvascular flap.
And one other pro point, sir, that I have kind of faced while I am operating is that when we operate the tongue, and for especially doing a wide local excision, we need to excise more of the muscular part than the mucosal, because the infiltrative spread through the muscle is much more than the mucosa.
Definitely, definitely, definitely.
Yes, sir.
I agree with you.